All right, hello, my name is Will. I'm going to be doing a general head, ear, nose, and throat assessment on you. So, generally, you look healthy, normal skin tone for ethnicity, no cyanosis, no jaundice, clean appearance, and no alopecia or missing hair. So, now I'm going to check your skin, checking for warmth and how it is warm, dry, intact. The nails look clean, flat, well groomed, capillary refill under 2 seconds, and then looking for skin mobility, which it comes up very easy, and turgor going back to its normal shape. Again, warm, dry, intact on this side, good skin mobility and turgor, clean, flat nails again, and cap refill about 2 seconds as well. And then generally, looking at your head, looks like a normal size, no obvious scarring, lesions, um, um, depressions. So now I'm going to palpate, looking for tenderness and any deformity. So you let me know if you feel any tenderness. So I'm also making sure I don't see any flaking. There's no depressions, no obvious lumps. Was there any tenderness?
No.
Okay, and no patchy hair loss that I could notice. All right. So now we're going to move to your nose. So your nose is midline, the bridge is flat. I don't see any obvious discharge or redness coming out of the nose. Can you occlude one nostril for me? Breathe in and out. Very good. Does that feel like the air is flowing smoothly? Okay, same with the other. Very good. Now we're going to look inside your nose, just looking for any abnormality. So tilt your head back. Great. All right. So it's nice and pink. Looks moist. The septum appears midline. The middle turbinate is visible, and no obvious foreign bodies or lesions or scratches. And then we'll check this nose. Pink, moist. Septum again appears midline. Middle turbinate is present, and again, no redness, discharge, or foreign bodies that can be seen. So now we'll move down to your mouth. Again, your mouth looks appropriate. Can you give me a big smile? Big symmetrical smile. Can you stick your tongue out? The tongue comes out midline, which is nice and appropriate. Can you open your mouth wide? So the tongue is pink, moist. It has a little bit of white film over it, which is normal, and some red spots. Can you just put your tongue back in your mouth real quick? So looking inside, the gum appears pink and moist, no obvious lesions, scarring, no random debris. Can you stick your tongue out and say ah? So saying ah, your uvula is midline, you can stop. Your uvula is midline, the soft palate raised with it, and I don't see any tonsils. Can you give me just a big smile with your teeth? The teeth appear healthy, clean, no obvious redness or cavities or loose teeth, but let's palpate real quick. Do you feel any tenderness? None of the teeth feel loose, and no obvious swelling. And then looking at the tongue, I don't see any lesions on the tongue either. It appears pink and moist again. All right. And then we're going to move to your neck. So your neck, I don't see any masses or deformities. When I'm checking for your trachea deviation, the trachea appears midline with two finger breadths between the trachea and the sternocleidomastoid muscle. And then when I'm looking at your thyroid, I feel like I can see the lower border right here. I'm going to palpate anteriorly first. So I can feel the isthmus, or the part that connects the two lobes, and I feel the left and right lobe, no nodules. Do you feel any tenderness? Okay. Now I'm going to check posteriorly. So again, feeling for that thyroid. All right, can you swallow for me? All right, and I feel the thyroid move up and down as it should with a swallow. All right, now I'm going to look at your lymph nodes, sinuses, and your TMJ. So first, let's do your sinuses. So I'm going to do your frontal and maxillary. I'm going to palpate first you're going to let me know if you feel any tenderness, then I'm going to tap, and again, feeling for tenderness. So checking your frontal, your maxillary, any tenderness? All right, now I'm going to percuss. Any tenderness?
No.
All right, now let's check your TMJ. I'm looking for mobility and tenderness and clicking. Can you open? All right, and then close. Did you feel any tenderness? All right, and I didn't feel any clicking, which is a normal finding. Now we're going to look at your lymph nodes. So this is your pre-auricular. They could be small and movable. They shouldn't be fixed, hard, or tender. Do you feel any tenderness? This is your post-auricular. This is your occipital, your tonsillar, your submandibular, your submental. Then we have your superficial cervical. Then we have your posterior cervical. Then your supraclavicular, which these should never be present. And then your deep cervical chain, which again, I should never really feel because of your sternocleidomastoid muscle. Okay? And then also, let's palpate your temporal artery while we're here. All right, and bilateral can feel that palpating, which is a normal finding. Now I'm going to listen to your neck. So I'm going to listen to your trachea, your thyroid, and your carotid. So first, let's listen to your thyroid for any bruits. I'm not able to hear any, which is normal. And then your carotids. I can hear a pulse, but no bruit for that as well. Now I'm listening to your trachea for your breath sounds. Take a deep breath in and out. All right, and in and out. All right, clear both sides, no high-pitched noise. I would suggest stridor or airway obstruction. So now we're done with your neck. We've done your mouth. We've done your nose. Let's move to your ears. So do the ears appear even on both sides? The tragus and the auricle both look clean. There's 3 earrings on both sides. No obvious discharge, swelling. Do you have any tenderness on the outside of your ears when I palpate? Okay. So now I'm going to look inside the ears. So I'm going to pull up and back, my otoscope in, and all right, so we have the pearly gray of the tympanic membrane, cone of light at 5 o'clock, a little bit of brown cerumen. I feel like I can just see the edge of the malleus, but no perforation, redness, discharge, or foreign body located in the ear canal. So now let's check your left ear. Again, pulling up and back to align the ear canal. And then again, we have the pearly gray tympanic membrane, no perforation, cone of light at 7 o'clock. A little bit of brown cerumen again, but again, no discharge, redness, swelling, or foreign body located in the ear canal. All right. Have you had any issues hearing?
No.
Okay. Well, if you were, we would start doing some tests. So we would start off with the whisper test. So I'm going to stand behind you about 2 feet. I'm going to occlude and rub this ear. Then I'm going to read off 3 letters or numbers, and you say them back to me. And then I'm going to exhale fully before saying it. 2, 3, 7.
2, 3, 7.
All right, very good. Now we'll switch to the other side. U5, 8.
U5, 8.
All right, very good. And then we would check for lateralization with the Weber test to see if one ear could hear better than the other. So I'm going to strike this and place this on the center of your head, and you tell me what you hear.
I hear a humming.
All right, both ears equal?
Both ears equal. And
Okay.
it's gone.
And it's gone. Okay. Then we would check for air conduction versus bone conduction with the Rhine test. So I'm going to strike this, place on your mastoid bone. You tell me when you stop hearing it on the bone, and then we're going to check in the air. Okay. You heard it longer in the air?
Yeah.
Okay. Now we'll check the other ear.
So,
Okay. And that was a normal find. You should be able to hear it in the air longer than you can for the bone. So now we'll move to your eyes. So looking at your eyes, they're equal, even size, no lid drooping, and no abnormal movement of your pupils. The eyebrows are even. I don't notice any swelling. The scleras are white. I don't see any redness, discharge, or foreign body inside. So now I'm going to check your lacrimal ducts. You tell me if you feel any tenderness. Any tenderness? I'm going to pull down your lower eyelid, which is pink and moist. Can you turn your pupils to the right and to the left? Again, sclera looks white. No obvious foreign bodies. The iris is brown. Looking at your pupils, usually I would have to dim the light for this, but for our purposes, we're going to leave the light on. The pupils are about 4 in size on both eyes. Now we're going to look for your Snellen chart. Do you wear glasses or contacts?
Contacts.
All right, so you would leave those in for this exam. We're not going to actually do it because we don't have a chart, but I'd have you stand 20 feet away, and then I'd have you read the lowest line you could possibly read. So, for example, if you could only read 20/60, that would mean you read, you're 20 feet away, and you're reading what somebody could read at 60 feet away. All right? Also, I could give you a pocket one, but I don't have that as well. So now let's do your, check your peripheral vision with the static finger test. So I'm going to close my right eye, you're going to close your left eye, and then you're going to tell me when you see my finger moves. Okay? No, say mine.
Mm-hmm.
Okay.
Mm-hmm.
Okay. Now the other one.
Mm-hmm.
Okay. All right. And now we were about 2 feet apart for that, so that's an appropriate distance. Now I'm going to check for your pupil's reaction to light, the direct reaction. So I'm going to shine this light in your eye. Stare straight for me. So that pupil constricts. And now we're looking for accommodation in the other one. That did happen. So now checking this eye. That pupil constricts. And this accommodates and does that. So now we'll check your near reaction. So I'm going to have you look at this pen light about 10 centimeters away, and then I'm going to have you look in the distance. So I'm looking for the pupils to convert, or eyes to converge on it, and the pupils to constrict. Now look away. So they go apart and they're dilating. Now go back to the pen, and the pupils constrict and converge again. Now I'm checking your extraocular normal muscle tone by shining this light directly in your eye. So can you stare straight for me? And I see the light reaction in the pupils. They're both about towards the nares, which is a normal finding. Now we're going to do the cover uncover test. So I'm going to have you cover your right eye. This is checking to see if your pupils or your eye moves once covered. So you can uncover now. And the iris and the pupil appear to have not moved, if at all. Now the other. All right, and uncover. And again, does not appear to move at all. All right, so now we're going to do the ophthalmic exam. So I'm going to shine this bright light in your eye. I'm looking for red reflex. I'm going to start on at 0. I'm looking for a red reflex in your eye, vessels, and also the fundus and the optic nerve. Since I can't turn down the light, I may not be able to see it, but if I can, that'd be great. So I'll just have you look right over my shoulder, and I'm going to come in at about a 15-degree angle. All right. So keep your head still. I believe I see the red reflex. Let me get a little bit closer. I can't really see vessels, optic nerve, or fundus, but that's what would be a normal finding. All right, now let's try the other eye. Again, I do believe I can see the red reflex. I feel like I can make more of the vessels out this time, but not fully. And again, I cannot see the optic nerve or the fundus with the lights on. All right. Now let's check the 6 cardinal movements of your eyes. So you're going to just follow my finger. This is checking for any nystagmus, lid lag, or abnormal movements, straining of the eyes. So I'm going to move my finger. You keep your head still and just follow with your pupils all the way to the right, up to the right, down to the right. The pupils are moving with it. There seems to be no nystagmus, no lid lagging. They move together, which is perfect. All right. So that's a good exam.